My name is Dr. Wright. I work in the NHS, a great establishment. Did you know that the NHS is nearly a pensioner? It's 65 years old this year. Now, I want to tell you a story about Kenny Young. Let's go back to 1948, where it all begins. Kenny, a young boy, has a problem with his ears, a common condition in children his age. He goes to his GP, who decides he needs to get a specialist to look at Kenny's ears. He writes a letter to the consultant at the local hospital. A few weeks later, Kenny receives an appointment letter through the post. His appointment is in 6 weeks' time. When Kenny arrives at the hospital, he sees a junior doctor who decides he requires a blood test and some hearing tests, and informs Kenny that he will need to return some weeks later to have them done. After 3 months, the tests are complete, he has his diagnosis, and is sent away with a course of treatment lined up. Does this sound familiar? Now, let's look at Kenny today. Not so much a spring chicken, and his ears are playing him up again. He goes to his GP, obviously not the same one, he retired a long time ago. Needing expert advice, the GP decides to refer Kenny to an ENT specialist at the same hospital. This brings back memories for Kenny. The GP dictates a letter to the specialist. A week later, Kenny receives a letter inviting him to make an appointment through Choose and Book, something different from the last time. Kenny calls up, chooses the earliest appointment in 6 weeks' time, and enters the date in his diary. On the appointment day, he goes to the hospital in good time for the clinic appointment. The clinic is running late. He is seen by a registrar who examines him and decides he needs blood tests, a hearing test, an MRI, and a few further tests. Kenny is told to return to the outpatient clinic in 3 months, once all the tests are complete, to see one on the team. Meanwhile, he should expect the appointments for all the investigations to arrive in the post. Sound familiar? It was familiar for Kenny, who reminisced that, apart from a few fancy new tests, the process was really much the same as when he was a boy. It brought back memories of lots of toing and froing between home and hospital. While he was waiting, Kenny imagined a new system. In his everyday life, Kenny texted, emailed, and used Skype. Why couldn't these things be used in the NHS to speed up the process and really overhaul the patient experience? Well, what Kenny didn't know was that the team at the Royal Free Hospital are already one step ahead. They have developed a new process, a new way of thinking called iConsult. Using the iConsult app, Kenny's GP has access to a wide choice of communication channels. He can email or phone the consultant direct, or even book a video consultation with a specialist. And Kenny's problem can be discussed there and then. The specialist would immediately be able to ascertain the tests Kenny required, organize for these to be done on a single day, and then arrange to see Kenny all on a single visit, saving all those extra trips to and from the hospital. Quite simply, modern communication channels costing the NHS virtually nothing, so easy to implement and so convenient for the patient. Now that his knees were hurting and his hearing wasn't great, imagine Kenny's delight knowing that he would only require a single journey to hospital, and how empowered both the GP and specialist would feel in taking their patient's treatment forward in such a way. It is time to change the way we do things here in the NHS. iConsult is definitely a winner in my book. Let the old tired and aging NHS process take retirement, and let's welcome the new member to the team, iConsult.